Inability to hold urine. Urinary incontinence, loss of bladder control, is a common and often embarrassing problem. The size comes from sometimes leaking urine when you cough or sneeze so that you crave sudden and hard urination that does not get to the toilet on time. Although it occurs more frequently as people get older, urinary incontinence is not an inevitable consequence of aging. If urinary incontinence affects your daily activities, do not hesitate to see your doctor. For many people, a simple lifestyle and dietary changes or medical care can treat symptoms of urinary incontinence. Symptoms: most people experience occasional small leaks, small amounts of urine. Some may lose a small amount of urine regularly. Types of urinary incontinence include: depression is uncontrollable. Urine leaks when you put pressure on your bladder by coughing, sneezing, laughing, exercising, or lifting something heavy. Urge not to hold back. She has a sudden, intense urge to urinate followed by uncontrolled urinary incontinence. You may need to urinate frequently, including overnight. Persistent recurrence can be caused by a minor condition, such as an infection, or a more serious condition such as a mood disorder or diabetes. The overflow of the flood. You experience frequent urination due to another chest that is not completely filled. Operational inefficiency. Physical or mental disabilities keep you from getting to the toilet on time. For example, if you have severe arthritis, you may not be able to unbutton your pants immediately. Mixed inconsistencies. You experience more than one type of urinary incontinence. This often refers to a combination of stress and insecurity, and you call for dysfunction. When to see a doctor, you may feel uncomfortable discussing disagreements with your doctor. However, if diarrhea is common or affects your health, it is important that you seek medical advice because urinary incontinence may. It causes you to limit your activities and limit your social interactions. Negative impact on your quality of life. Increase the risk of adult falls as they rush to the toilet. Indicate the most critical situation. Causes urinary incontinence can be caused by daily habits, poor health conditions, or physical problems. A thorough examination by your doctor can help determine what is causing your outbreak. Temporary urinary incontinence. Certain drinks, foods, and medications can act as diuretics. They stimulate your bladder and increase your urine volume. Includes alcohol, caffeine drinks with water and clear water, artificial sweeteners, chocolate, pepper foods high in spices, sugar, or acid, especially citrus fruits, cardiovascular and blood pressure medications, antidepressants, and sedatives. Large doses of vitamin C. Urinary incontinence can be caused by an easily treatable medical condition, such as urinary tract infections. Infection can irritate your bladder, make you crave urination, and, in some cases, out of control. Constipation. The rectum is located next to another and shares many similar nerves. A tight stool, attached to your rectum, makes these nerves more active and increases the frequency of urination. Incontinence of urinary incontinence. Urinary incontinence can also be a chronic condition caused by underlying physical problems or changes, including pregnancy. Hormonal changes and increased fetal weight can lead to dysfunction. Childbirth. Genital delivery can reduce the muscles needed to control the bladder and damage the bladder nerves and supporting tissues, resulting in a downward, excessive, lower extremity. With a large rupture, the bladder, uterus, rectum, or small intestine can be pulled down from the normal area and out into the vagina. Such emergence may be associated with impunity. Changes over the years. The aging of the bladder muscles can reduce a bird's ability to store urine. Also, non-invasive abdominal contraceptives are more common as you get older. Menopause. After menopause, women produce less estrogen, a hormone that helps keep the bladder and urethra healthy. Deterioration of these tissues can exacerbate seizures. Enlarged prostate. Especially in older men, the disorder is often caused by an enlarged prostate gland, a condition known as benign prostatic hyperplasia. Prostate cancer. In men, depression or uncontrollable recurrence may be associated with untreated prostate cancer. But often, uncontrolled sex is a side effect of prostate cancer treatment. Prohibition. A tumor wherever your urine is found can block the normal flow of urine, which has led to an overflow of urine. Urine stones, a heavy mass, similar to a stone formed in the bladder, sometimes cause urine leakage. Emotional disorders. Multiple sclerosis, Parkinson's disease, stroke, brain tumor, or spinal cord injury can interfere with the sensory signals involved in bladder control, causing urinary incontinence. Risk factors. Factors that increase the risk of developing urinary incontinence include gender. Women are more likely to experience stress instability. Pregnancy, childbirth, menstruation, and the general anatomy of women are these differences. However, men with prostate gland problems are at increased risk of deprivation and over-control. Age. As you grow older, the muscles in your bladder and urethra lose some of their strength. Age changes reduce how much your bladder can hold and increase the chances of urinary incontinence. Obesity. Excess weight increases the pressure on your bladder and surrounding muscles, making them weaker and allowing urine to come out when you cough or sneeze. Smoking. Tobacco use may increase the risk of urinary incontinence. Family history. If a close family member has urinary incontinence, especially to urge uncontrollability, your risk of developing the condition is higher. Other diseases. Neurology or diabetes can increase the risk of uncontrolled problems. Chronic urinary incontinence problems include skin problems. Skin rashes, skin infections, and sores can grow from regular wet skin. Urinary tract infections. Uncontrolled increases the risk of recurrent urinary tract infections. Impacts on your personal life. Urinary incontinence can affect your relationships with the community, work, and relationships. Prevention. Urinary incontinence is not always prevented. However, to help reduce your risk, maintain a healthy weight, get regular exercise, avoid bladder irritants, such as caffeine, alcohol, and acidic foods, eat extra fiber, which can prevent constipation, causing urinary incontinence. Don't smoke, or seek help to quit if you smoke. Ability to hold urine. Diagnosis. It is important to determine the type of urinary incontinence you have, and your symptoms often tell your doctor what type you have. That knowledge will guide medical decisions. Your doctor may begin with a complete history and physical examination. You may then be asked to perform a simple procedure that may indicate dysfunction, such as a cough. Thereafter, your doctor will recommend urine test. A sample of your urine has been tested for signs of infection, blood clots, or other abnormalities. 1. Diary. For a few days you record how much you drink when you urinate, and the amount of urine you produce, even if you have a desire to urinate, and the number of uncontrollable episodes. Post-void residual rate. Please urinate, not work, in a urinal. Your doctor then checks the amount of urine left in your bladder using a catheter or ultrasound test. A large amount of urine left in your bladder may mean you have a blockage in your urinary tract or have a problem with your nerves or muscles. If more details are needed, your doctor may recommend more specific tests, such as urodynamic tests and pelvic ultrasounds. These tests are usually performed when you are considering surgery. Treatment of urinary incontinence depends on the type of uncontrollability, its severity, and the underlying cause. A combination of treatments may be required. If the underlying condition causes your symptoms, your doctor will begin to treat the condition. Your doctor may recommend non-invasive treatment, to begin with, and then move on to other options if these methods fail to help you. Behavior. Your doctor may recommend another training, delaying urination after gaining the desire to walk. You can start by trying to hold for 10 minutes every time you feel the urge to urinate. The goal is to extend the time between trips to the toilet until you only urinate every 2.5 to 3.5 hours. Double closure, to help you learn to remove the bladder completely to avoid overcrowding. To double means to urinate, then wait a few minutes and try again. Scheduled house trips, urinating every 2 to 4 hours rather than waiting for the need to travel. Fluid management and diet, so you can regain control of your bladder. You may need to reduce or avoid alcohol, caffeine, or acidic foods. Reducing fluid consumption, losing weight, or gaining weight can also reduce the problem. Examination of pelvic floor muscles. Your doctor may recommend that you do these exercises regularly to strengthen the muscles that help control urination. Also known as Kegel exercise, These techniques are especially effective in depressive disorders but can also help promote abstinence. To perform pelvic floor exercises, consider trying to stop your urine flow. Then, tighten, click, the muscles you can use to stop urinating and hold for 5 seconds, then rest for 5 seconds. If this is very difficult, first hold for 2 seconds and then rest for 3 seconds. Work on the changed grip for 10 seconds at a time. Plan at least 3 sets of 10 repetitions each day. To help you identify and align proper muscles, your doctor may suggest that you work with a pelvic floor surgeon or try biofeedback techniques. Medications commonly used to treat uncontrollability include anticholinergics. These drugs can reduce excessive bladder and can help reduce uncontrollability. Examples include oxybutynin, Ditropan XL, tolterodine, Detrol, darafenacin, Anablix, fesoterodine, Toviaz, solifenacin, Vesicare, and trospium chloride. Mirabegron, Myrbetriq. Used to treat incontinence, the drug stimulates the muscles of the bladder and can increase the amount of urine that the bladder can hold. It can also increase the amount of urine you can urinate at the same time, helping to remove the bladder completely. Alpha blockers. For men who indulge in constipation or bloating, these medications relax the bladder neck muscles and muscle fibers in the prostate and make it easier to remove the bladder. Examples include tamsulosin, Flomax, alfuzosin, urazatril, silodosin, Rapaflo, and doxazosin, Cartera. The topic of estrogen. Applying a low-dose, topical estrogen in the form of a vaginal cream, ring, or pussy can help tone and rejuvenate the tissues in the urinary tract and genitals. Electrical stimulation electrodes are temporarily inserted into your vagina or genital area to stimulate and strengthen the pelvic floor muscles. Gentle stimulation can work to reduce stress and encourage dysfunction, but you may need more treatment in a few months. Medical equipment devices designed to treat women with abstinence include a urethral implant, a small device, similar to a disposable tampon inserted into the urethra before a particular activity, such as tennis, can cause discomfort. The insert acts as a plug to prevent leakage and is removed before urination. Pessary, a flexible silicone ring that you insert on your vagina and wear throughout the day. This device is also used for women with prolapse of the vagina. The pessary helps to support the urethra, preventing urinary leakage. Interventional therapies remedies that can help with the problem include bulk material injections. The synthetic material is inserted into the tissues around the urethra. Swimwear helps keep the urethra closed and reduces leakage of urine. This procedure is for the treatment of depressive disorders and is usually less effective than more aggressive therapies such as surgery. It may need to be repeated several times. Onabotulinum A, Botox. Botox injections into bladder muscles can benefit people with an overactive bladder and promote uncontrollability. Botox is prescribed for people only if other treatments have failed. Emotional stimuli. There are 2 types of devices that use painless electrical stimulation to stimulate the nerves involved in the control of the bladder, sacral nerves. One type is placed under your skin at your hips and attached to the lower back straps. Another type is a removable plug that is inserted into the vagina. Sacral nerve stimulation can control an overactive bladder and stimulate dysfunction if other treatments do not work. Surgery if other treatments do not work. Several surgical procedures can treat problems that cause urinary incontinence, throwing processes. Synthetic materials, mesh, or tissue fibers of your body are used to form the pelvic girdle beneath your urethra and the thick muscle area where the bladder connects to urine, bladder neck. The rash helps keep the urethra closed, especially if you are coughing or sneezing. This procedure is used to treat stress disorders. Suspension of the neck of the bladder. This procedure is designed to support your urethra as well and bladder neck, an area of thickened muscle where the bladder connects to the urethra. It involves an abdominal incision, so it's done during general or spinal anesthesia. Prolapse surgery. In women who have pelvic organ prolapse and mixed incontinence, surgery may include a combination of a sling procedure and prolapse surgery. Repair of pelvic organ prolapse alone does not routinely improve urinary incontinence symptoms. Artificial urinary sphincter. A small, fluid-filled ring is implanted around the bladder neck to keep the urinary sphincter shut until there's a need to urinate. To urinate, you press a valve implanted under your skin that causes the ring to deflate and allows urine from your bladder to flow. Absorbent pads and catheters. If medical treatments can't eliminate your incontinence, you can try products that help ease the discomfort and inconvenience of leaking urine: pads and protective garments. Most products are no more bulky than normal underwear and can be easily worn under everyday clothing. Men who have problems with dribbles of urine can use a drip collector, a small pocket of absorbent padding that's worn over the penis and held in place by close-fitting underwear. Catheter. If you're incontinent because your bladder doesn't empty properly, your doctor may recommend that you learn to insert a soft tube, catheter, into your urethra several times a day to drain your bladder. You'll be instructed on how to clean these catheters for safe reuse. Lifestyle and home remedies. Problems with urine leakage may require you to take extra care to prevent skin irritation. Use a washcloth to clean yourself. Allow your skin to air dry. Avoid frequent washing and douching because these can overwhelm your body's natural defenses against bladder infections. Consider using barrier cream, such as petroleum jelly or cocoa butter, to protect your skin from urine. Ask your doctor about special cleansers made to remove urine that may be less drying than other products. If you have urge incontinence or nighttime incontinence, make the toilet more convenient. Move any rugs or furniture you might trip over or collide with on the way to the toilet. Use a night light to illuminate your path and reduce your risk of falling. If you have functional incontinence, you might keep a bedside commode in your bedroom, install an elevated toilet seat, widen an existing bathroom doorway. Alternative medicine. There are no alternative medicine therapies that have been proved to cure urinary incontinence. Early studies have shown that acupuncture can provide some benefits. Yoga also may provide some benefits for urinary incontinence, but more study is needed. Coping and support. If you're embarrassed about a bladder control problem, you may try to cope on your own by wearing absorbent pads, carrying extra clothes, or even avoiding going out. But effective treatments are available for urinary incontinence. It's important to ask your doctor about treatment. Once you do, you'll be on your way to regaining an active and confident life. Preparing for your appointment. If you have urinary incontinence, you're likely to start by seeing your primary care doctor. You may be referred to a doctor who specializes in urinary tract disorders, urologist, or a gynecologist with special training in female bladder problems and urinary function, urogynecologist. What you can do to get ready for your appointment. It helps to be aware of any pre-appointment restrictions, such as restricting your diet. Write down your symptoms, including how often you urinate, nighttime bladder activity, and episodes of incontinence. Make a list of all your medications, vitamins, and supplements, including doses and how often you take the medication. Write down key medical information, including other conditions you may have. Ask a relative or friend to accompany you. To help you remember what the doctor says, take a notebook or electronic device with you, and use it to note important information during your visit. Write down questions to ask your doctor for urinary incontinence. Some basic questions to ask your doctor include: what's the most likely cause of my symptoms? What kinds of tests do I need? Do these tests require any special preparation? Is my urinary incontinence temporary? What treatments are available? Should I anticipate any side effects of the treatment? Is there a generic alternative to the medicine you're prescribing for me? I have other health conditions. How can I best manage these conditions together? Don't hesitate to ask other questions during your appointment as they occur to you. What to expect from your doctor. Your doctor is likely to ask you a few questions, such as: when did you first begin experiencing symptoms, and how severe are they? Have your symptoms been continuous or occasional? What, if anything, seems to improve or worsen your symptoms? How often do you need to urinate? When do you leak urine? Do you have trouble emptying your bladder? Have you noticed blood in your urine? Do you smoke? How often do you drink alcohol and caffeinated beverages? How often do you eat spicy, sugary, or acidic foods?